It is often said that a healthy nation is a wealthy nation. The St. Jude Hospital remains under construction following 15 years under successive governments, while the OKEU suffers from long wait times, shortages of basic equipment, medication, and recent resignations of key medical personnel have reportedly compounded the situation. Questions abound as to how the healthcare sector could deteriorate to such a state. Health Minister Moses Baptiste alleges that the situation exacerbated under the ALLEN-CHASTANET-led government when the services of a Cayman Islands-based entity was sought for the OKEU transition, later saddling the institution with a hefty bill and miring the sector in debt.
Everything was set. And you know what? They destroyed it. And for approximately $25 million, they brought in a group from Cayman called Cayman City and their associates. And his plan, and he said it on television with Rick Wayne, his plan was to privatize the institutions. And he said, do you believe a private entity will come and just do that for nothing? That was their plan, to privatize the institutions. And they were also going for the St. Jude Hospital for profit. Mr. Speaker, when they talk about health care, privatize it for profit.
During debate in Parliament, Baptiste alleges that the move from Victoria Hospital to OKEU was ill-thought and was only expedited due to the pandemic, amounting to even more debt for the Owen King Hospital.
The transition from Victoria Hospital to Owen King EU Hospital was rushed, disorganized, without thought, because the COVID-19 pandemic forced the then government to do what they should have done long time ago. On March 20th, 2020, they were forced to move the hospital. So how do you expect to move a hospital, to transition a hospital with a forced movement? They were forced because they remained from 2016 up to 2020, and nothing was done to transition the hospital to OKEU. And all of the debt, all of the payables, all of the problems were shifted to the Owen King EU Hospital.
Minister Baptiste also claimed that the pandemic dealt a serious blow to the healthcare system, with a population already debilitated with chronic ailments like diabetes and hypertension. Moreover, the propensity for violence and mishaps stretched emergency rooms to the limit.
The COVID-19 pandemic in St. Lucia, the last set of protocols were really in 2022, between September to December of 2022. So all of this time, when we came into government, we were dealing with the COVID-19 pandemic until 2022, December, when things started to, that was the first year we started to have a Christmas where people were a little free up. December 2022. So the hospital, like other hospitals in St. Lucia, like the St. Jude Hospital and other health facilities, were grappling with the COVID-19 pandemic, Delta variant in particular. We suffered much.
The state of the island's healthcare sector has constrained public medical services, but Baptiste says this did not happen overnight. The Philip J. Pierre-led government has vowed to complete the St. Jude Hospital. Officials say the administration has donated millions to alleviate the debt at the Hobbles OKEU Hospital, which will see the construction of an overdue wing. Furthermore, they claim that the wellness centers, some of which are closed, are undergoing major repairs in a bid to improve health services. Victoria Hospital will become an urban polyclinic in a coordinated effort with these institutions. Gina Filippi, HDS News Force.